Thursday, everybody. Councilmember 5 here for our regular live, and today we're on site. We usually don't do this. It's the first time ever, so we're a little behind, but you are not going to be disappointed. Today we are at the Chappell Hayes Health Center at McClymond's High School, and so we're going to do a quick tour and talk to you about the services that are right here in the middle of your community. So check it out.
So good to see you. Welcome. So,
as we enter, come and hear a little bit about the program.
come on in to the Chappell Hayes Health Center.
And we have a special guest here that I did not know was going to be here. Why don't we introduce everybody? Let you introduce yourselves. Where should we start?
Afternoon, Jeffrey Taylor. I'm the principal here at McClymond's.
Hi, folks. I'm Santoy Trotter. I'm the clinical director of our school-based behavioral health services here at the Chappell Hayes Health Center and Children's Hospital Oakland School-Based Health Centers.
Good afternoon, everyone. My name is Joycelyn Garrett. I am the director of our F2AC at UCSF Benioff Children's Hospital Oakland, which includes our lovely school-based health centers, including this one.
Hi everyone, I'm Dr. Emily Frank. I am a pediatrician and the medical director at our school-based health centers here at McClymond's and also at Castlemont.
And we also have the amazing Chief of Staff, Tanya Love, that's also here with us. So I would love for you all to give us a tour and tell us about the resources that you offer in the center.
Absolutely. Come on in. Come on into the space. So we want to actually start with acknowledging Chappell Hayes and his beautiful face shines over us all the time. Chappell Hayes was an environmental activist, justice activist here in West Oakland, and also taught shop right here in this very space at McClymond's. What happened was a group of students, parents, community members came together and said, we need healthcare right here at McClymond's, and worked together with a couple different foundations and the county, and together created the Chappell Hayes School-Based Health Clinic. We are open and available to young people and their families. We provide primary care, so anything you would go to your regular doctor for, and we can become someone's medical home. We also provide confidential reproductive health care or sexual health care for young people, for teenagers, and mental health care. So that's counseling, individual therapy, family therapy. We'll go a little bit more into detail. And we have an amazing health education team, and their job is really health promotion. Mm-hmm. So going into the school, going into classrooms, doing health fairs, and then also supporting our amazing youth wellness advisory board. So we have young people who help us do our job better, right? Help us be accountable to the community, think about things that we might be implementing, think about the best way to have them be friendly to adolescents and teens. And they also go out and teach their peers and teach their families about all sorts of health.
It's just amazing. So the youth have a voice in this space.
Absolutely. It's imperative. I mean, we believe like nothing for us without us, right? And so we can't be healthcare providers for young people without them being actively involved in the healthcare that we provide.
I love that. Nothing about us without us.
Nope.
Right. So what else is in the clinic?
So come on back. I'm going to start with Dr. Frank. Welcome. So everyone is welcome here. Come on in. Come on in. So if you're a young person coming to a medical appointment, what would happen?
Yeah, so welcome. In terms of healthcare services, there's a lot that we offer. So for patients who are part of the Children's Hospital Oakland network, we're able to do well child checks, vaccines, lab work, physical exams, sports physicals. We're also able to help with just other issues that come up. Maybe stomach issues, maybe acne, maybe a new rash, maybe an ankle sprain. So we're able, for folks who are in our network, we're able to provide all of those. And then for any young person, we're able to provide reproductive health care services. So whether they might need screening for sexually transmitted infections or be interested in starting birth control. those are other services that we're able to provide right here in clinic. And then we're also working on expanding our integrative services. And so if there's a young person who's interested in acutherapy like acupuncture or seeds or hypnosis, that's another modality that we're beginning to offer here. So lots offered. These are our exam rooms, high ceilings, but they're still exam rooms. Where should we head next?
We'd love to show you some of our counseling offices and where we provide mental health services. As we're walking down the hall, we all know, like before the pandemic, mental health was a priority. And we were in some ways, like for those of us in the field, think about like, we were in a crisis. Like we didn't have enough services for young people, for adolescents. And as we're coming out of the urgent part of the pandemic where we're all in isolation, one of the things that we all know is like we need connection and we need support. And really we need mental health services that are maybe not always like that traditional, like kind of sitting in an office with a therapist. We need services that are provided by people who look like our clients, right? By Black and brown folks. We need services that are culturally responsive, that are adolescent focused. And so that's what we do here. This is one of our therapy offices. Ashlyn Davis is here. She's our mental health team lead. She's awesome. And, you know, if someone is feeling down, depressed, anxious, worried, I know many of us have experienced trauma, whether in our own families, in community. We're all kind of impacted by community violence, especially in the communities that we serve, right, in West and East Oakland. Sometimes we're holding a heavy burden on our heart. Sometimes we have trouble sleeping. We haven't slept for a long time. We're having nightmares. Sometimes we stop eating or don't eat a lot, or eat a lot to kind of cope or soothe with something. So those are some reasons why it might be good to talk to a therapist or mental health provider. One of the things that we pride ourselves on is, you know, being accessible. So we're here at schools to young people, and we also serve the community here in West Oakland, but also bringing the best quality services. And so services that, modalities that have been researched, that have been proven to be effective. I think a lot of times you think, oh, I'm going to go sit and talk to a therapist, but is anything going to get better? Right? It's like, why should I share what's going on in my heart? And I know, like, I come from communities, maybe you come from a community where it's like, you're not supposed to share your business. You're not supposed to talk about what's going on. And yet, what I know, coming from those same communities, is that we deserve mental health too, right? We deserve emotional health and well-being. And so we want everybody to thrive and to be well because we need you, right? We need you to kind of help make this world as best as it can be. And so I invite folks to kind of try it out. I've worked here for a long time. I work here for a long time because I see people get better. And so that's part of our mental health services. That was Ashlyn's office. I'm going to show you Ebony's office. I hope she's okay. One of the things that Ebony brings, I'm going to kind of bring you this cocoa butter chart, is really, again, making sure that our services meet the needs of Black and brown, people of color, queer folks, anyone who really needs services, and especially thinking about folks who, those of us who are like on the margins, bringing that into the center of our work and into care. I don't know if I'm making sense here, but I'm trying.
You are.
But so, you know, really thinking about what are the images, what are the stories, right? That we know that culture is healing, and so we want to integrate culture into the work that we're doing. We want to hear stories and really make room and space, right, for that. And there's some things that you don't want to have to explain to someone, right? And so hopefully our team kind of comes with a little bit of knowing of, you know, we don't walk in each other's shoes, but a little bit knowing so you don't have to explain everything when you're sitting with a therapist. So that's a little bit.
This office smells amazing. It smells like
aromatherapy. We're doing activity next Wednesday, so folks are invited. Come by. We serve young people ages 12 to 21 for our mental health services. So just so you have a little bit of that information in terms of who can come. And it's not open to McClymond's student, but also open to our broader community as well.
Mm-hmm. So, like, if I got a cold, I could come in here and get care.
If you were between the ages of 11 and 24, right, for medical care,
Sure,
you
I
could come in here.
I'm 24.
Come in here. and get care. And if maybe you can speak to kind of primary care versus other services.
Yeah, so the world of insurance is always a complicated one. So we're set up to provide any young person 11 through 25 with reproductive health care. So anybody can come in here for a pregnancy test, for a test for sexually transmitted infections, if they wanted an IUD or an implant, anybody between ages 11 and 25 are able to treat. We can certainly become people's primary medical home. And so what that means is for patients who say, oh, I want to be a patient of the Children's Hospital Oakland Network, then you can come see us for your cold. You can come see us for your stubbed toe. You can come see us if you're feeling sick to your stomach or for whatever else comes up. We are able to do sort of an acute urgent care appointment for a student at McClymond's. So if they're at school and they're throwing up and they're feeling awful, yes, we can see them. But ultimately, to be able to provide ongoing care, we need patients to just set up so that their primary care doctor is a primary care doctor somewhere within the Children's Hospital Oakland Network.
Cool. Great.
I have one more place I want to show. It's not going to smell quite as good as that. But something that I think is really special about this clinic that a lot of primary care clinics don't necessarily have is we actually have a lab right here. And so if you come see us and we realize, oh, you know, we need to check your blood work, we need to check your cholesterol levels, you don't have to then go to a separate lab and have a separate lab appointment. You can sit right there in that chair and one of our nurses will take care of drawing blood for you. We also do vaccines right here. And then our microscope actually can let us look at samples under the microscope to see if someone needs a particular kind of treatment. And so we're able to take care of a lot of needs right here in this space.
All right.
We're going to One of the things that we have this summer is actually youth interns that are here as well. So they're here every morning, I think 3 days a week, to think about our services with us. And so I just wanted to shout out our house interns. And they're from different schools. So we have one person from McClymond's, another person who's from Oakland High, and another person who goes to Redstone. So those are 3 health interns that are here at McClymond's. And again, I think it speaks to we are centered here in West Oakland, located here at McClymond's, and then open to the community that is here in West Oakland. And so I would say, like, bring your cousin, bring your friend, bring your sister, right? If there are other folks, so you may not have a health center at your school, or if there are parents or uncles or aunts or grandmas watching, right? If you don't have a health center at your kid's school, know that they could come here to this clinic in West Oakland. You might be wondering, when are we open, right? It's summertime. What are you doing here? And so just to hold that we are still open during the summer. Our clinic is open Monday through Thursday in terms of being able to come in to schedule an appointment. For our medical services, those are on specific times. And
we're switching our hours a little bit come July 1, which is right around the corner. And so we are open Tuesday through Thursday afternoons for medical care.
Awesome. Great. Any other questions? Council member?
I think that was a very thorough tour. And I think that we want as many people to know about the services in this space as possible. This is a beautiful resource. And for the 25 to 28 years that I've lived here, I didn't know that so many resources were right here in this health clinic. And so, you know, I had events next door all the time. I didn't know that there was a full service health clinic that community could take advantage of right here. I knew there was, you know, some medical stuff. I just thought it was for the school, right? I didn't know just how extensive this was, and especially post-COVID, when there were so many young people that were experiencing mental health crises and needs and just challenges from being, you know, just sequestered and not for all of the different things, right? That they can come here and have someone to talk to and have things that they can get involved in. And then on top of that, just allowing, not even just allowing, but understanding that young people need a voice in their care is really, really just revolutionary to me. And then the reproductive services that you offer. I mean, Oakland is amazing. And West Oakland, though?
Yeah.
West Oakland, though? And I know you're just running over here from Castlemont, just the investment of what you all do in East and West Oakland is so critical to our residents here. So, number one, thank you. Thank you all. Thank you all for giving us the opportunity to just highlight what you do, share it with the larger community, and just for being here, centered in one of the places that needs it the most. So you're building on a strong legacy in West Oakland with the Panthers and how they provide community care.
Yeah.
And, you know, Chappell Hayes, this is just beautiful to me. It's actually one of the highlights of my day. So thank you all.
We love being here, and you are so inspiring and inspire us to come to work and do our jobs every day.
Yeah.
I think one of the things, Councilperson Price, that you spoke about in terms of past pandemic is the amount of grief and loss that the community is holding, right? And we know that grief also impacts our emotional health, but also our physical health and well-being, right? And so I think just really wanting to, you know, for folks to kind of notice, like, how are they feeling, what's going on for them, what do they need, you know, and being open to kind of talking to a healthcare provider about that. I think that one other thing I was just thinking about is we want to hear from you. We want to hear from your, you know, folks in this community about, you know, because we know that it's a, you know, we are here at your service as an institution. We're part of, you know, Children's Hospital Oakland, UCSF, which is across both bays. You know, there's a level of expertise that we bring, but we know the real expertise is here in the community. And so, you know, if you're wondering about us, if you've heard about us, if you've been here before, please just come. You know, we're going to have some community events next year, some events open for parents, family, caregivers, because we really want to hear how we can continue to best serve or better serve the community.
And one of the things we also talked about in line with what you're speaking of is tying this center into our town nights.
Yes.
So I talked to our Department of Violence Prevention about that, and so they're interested in it as well. So that's something that we can look to for the future. And I also have been talking to a lot of young people, and there's this one rapper in particular, I'm not gonna say his name, but he wants to do more around mental health services.
Oh, yeah.
And so maybe we can tie in with the work that he's trying to do with his upcoming album, telling people to seek out mental health care when they need it for young people, because his fans and the people who listen to him are young people. And so he's trying to use his platform to say, mental health care is your own personal self-care. So take advantage of it. Start to try to listen to that voice so you're not taking it out on yourself or other people. So there are a lot of opportunities to partner in the future. And so if you all are open, I'm open.
Yeah, we're here.
Our
Youth Wellness Advisory Board, so, you know, McClymond's students have actually done a lot of work in the area of mental health, and so I think they also do some to contribute in that area, so.
Do you have internships, or do you have youth that are not a part of McClymond's who come in?
Yes, so this is our second year offering what we're calling Center for Science Education and Outreach summer internships, which is the one that you referenced earlier on. And so, yes, we love getting young people involved in the work that we're doing, and we need them. We need their creativity. One of the young people who's an intern is a student at McClymond's. One of the others is not a McClymond's student, but lives right here in West Oakland. And so it's able to share with us so many wonderful ideas. I mean, the internships, they're not just for the students, right? We really grow from their involvement and their perspective. So for now, what we have is summer internships, and hopefully that will expand over time.
There's also an opportunity to get into an internship through the greater UCSF Benioff Children's Hospital Oakland, and they will work with the different services to position the students in different areas. So one of the areas that they could also work in could be McClymond's. So there are opportunities out there for students to come in and see, you know, healthcare in its whole. Yeah.
This is great. Did you all know all this was out there?
Yeah.
This is so awesome. So we're gonna share out this video. just outside of this live that's happening today, we're gonna keep recirculating this information. We're gonna cut it up so we can share it easily with shorter clips. But I just think this is a huge resource and more people need to know about it. So if you want to find out more about how your young person or you as a young person can participate or take advantage of the resources here, what's the way to find out again?
You can call 510-835-1393 to make an appointment. You could come down to Oakland, to McClymond's High School and say, where's the health clinic? And make an appointment. But go ahead and just call. I know it's summer, folks are at home. Give us a call to schedule an appointment. We're here. We look forward to seeing you.
Awesome. And we have one question actually in the chat. Auntie Nadell says, thank you for recognizing this wonderful clinic named for my dear departed husband. And he has one question. If OUSD changes the configuration of McClymond's, will the clinic have to move?
The clinic might move here to that part, but will still be a part of McClymond's. And hello, Nancy Nadell. I'm so happy when I first met you over at McClymond's Youth and Family Center. And part of that meeting actually inspired me to keep telling Chappell Hayes' story over and over again. So every new person who comes in here, every new staff is oriented to the history of Chappell Hayes and the amazing work he's done, and we're inspired by him every day. In terms of the clinic moving, yes, it seems like the plan is for it to move, but actually to be more embedded as a part of the school, making it easier for students to access, and will still be open to the community. So that's part of the plan, but we're in conversation.
Yes, there are lots of meetings happening here at the phase where they'll start to have conversations with the leadership at UCSF, BCH Oakland, to start thinking about what we need in terms of moving into a new space, what we need to be able to provide services while they're remodeling. So all of that is in the works, and we hope to be able to continue services throughout the construction and remodeling so that you guys still have access to all of us. And I do want to just mention also that being a member of our school-based health center McClymond's gives you access to University of California, San Francisco, Benioff Children's Hospital, Oakland, specialty services as well. So there are a lot of services that you can get that don't just live here. So you can come here, but be referred to neurology, neurosurgery over at the main hospital in Oakland. So what we have here is wonderful, and the access that we can provide to the other services is also a great opportunity for all. So we hope to see you soon.
Awesome. All right. Okay, we're going to sign off. Feel free to wave. Bye, everyone.